Hi, good afternoon. My name is Frank Warren, last name spelled W-A-R-R-E-N. I'm filling in as the designated media contact for this weekend for the San Luis Obispo County COVID-19 Public Information Response Team. This afternoon, once again, we have our Emergency Services Director, Mr. Wade Horton, and the County Public Health Officer, Dr. Penny Bornstein, to speak with you. As always, we are joined by a fabulous ILRC interpreter. Today we welcome Emily Furr, last name spelled F-U-R-R. Mr. Horton will make comments first, and then we will turn it over to Dr. Bornstein. Of course, we will then welcome your questions. For those of you in the room, I'm going to ask today, so we can help out with our audio, that you step forward and project when you ask your questions today, so that we can be sure that everyone gets to hear your questions. Don't forget, all of these resources that are available and everything we talk about today will be put up on www.readyslow.org. With that, let's turn it over to Mr. Horton.
Thank you, Frank. Good afternoon, Wade Horton, County Administrative Officer and Emergency Services Director. Before I turn it over to Dr. Penny Bornstein for a medical situation update, I have a couple points I'd like to share with all of you. First, I'd like to thank the public and our business community for working together to meet the intent of the shelter-at-home order. Again, we are taking action now as a community to limit the spread of this disease so we can return to normal as soon as possible. We have received hundreds of questions through our call center on what's considered an essential business and what's not. We'll be updating the guidelines for businesses, employers, and employees today, which will be available at readyslow.org. I would like to note that following a conversation with our Sheriff, Ian Parkinson, licensed firearm retailers will be allowed to continue operation, given that they maintain social distancing requirements to protect their customers. I'd also like to add that beginning tomorrow, county health inspectors will visit businesses who hold a permit issued by the health department and will be answering questions and ensuring that they are doing what they need to protect public health. On that note, preventing the spread of the virus among our homeless population is one of our many priorities. Today, we are signing agreements with 4 motels throughout our region to provide housing to homeless individuals who are symptomatic or who have been diagnosed with COVID-19. We have no diagnosis of homeless individuals yet, but we are preparing for it. Referrals will be managed by our nonprofit partners, Capslo, ECHO, and 5 Cities Homeless Coalition. We continue to talk to local motel owners and will expand capacity if needed. More information regarding this program will be available tomorrow at readyslow.org. I know this is a stressful time for everybody, and I understand that we are receiving an increase in domestic violence calls for this month compared to the previous March. If you or a loved one need to talk to somebody about this, please call 855-886-7473. Again, that's 855-886-7473. We'll also put this information up on readyslow.org. I'll now turn it over to Dr. Bornstein for the public health update.
Thank you. Good afternoon. Dr. Penny Bornstein here. I'm the County Health Officer. And not much has changed since we last met here 24 hours ago. Our case count has gone up to 27 individuals. That is about the rate of increase that we anticipated. We still have 1 hospitalized patient in intensive care. We have 1 other hospitalized patient outside of our county. But otherwise, everybody is home and doing well. And 2 of our case count have actually now fully recovered and are released from monitoring by the public health system. We now have our first 2 cases in children. Both of those are of high school age, and they are contacts of confirmed cases. The confirmed case themselves has traveled, so having that kind of household spread is not at all unanticipated. With respect to our testing capability, we still are testing the same high priority groups, and we still have sufficient supply, and we are expecting to get more in the early part of the week. That said, we continue to try to move the needle and be able to significantly amplify the testing availability for our residents, and we're doing that in two ways. One is we are continuing to try to get a high throughput machine to be available at one of our community hospitals so that we don't have to rely on private systems of care outside of our county. And the other means is, some of you may have seen hot off the press news that a new point of care test is now available. The company that makes that test is called Cepheid, and we have a contract with them, so that puts us in a good position to try to get that point of care test available sooner rather than later. We don't know the time frame at all for that, but we have already reached out to the company and are making our desire known for that test. Let me tell you what point of care test means and why this is so exciting. That means that the test can be done on the patient, on site, whether it's at a clinic or a hospital, and the test results turned around in 45 minutes or so, and the patient given their result right then and there while they wait. So there are a number of things moving on the testing front, and we are well poised to jump on all of the opportunities that stand before us. I did want to just add one thing related to measures for infection control. I've gotten questions along the lines. Yesterday I was asked about packaging. Today some of the questions that have come my way regard the essential business functions. So going to a grocery store or pumping your gas is not only of some measure of concern because there may be other people in those facilities or people lined up in some fashion, but the actual material that you touch and use while accessing these services, such as shopping carts or the gas pump handle, is of some concern. I want to reiterate that the vast majority of cases are believed to be transmitted through direct contact with individuals rather than surfaces, but we have all along said that surfaces indeed may be a means of exposure. So for those, especially in high-risk categories, who want to take the extra measures of making sure that they avoid all possible means of transmission, it is certainly reasonable to either use that which is available at those facilities or even bring your own hand wipes. I know that may be difficult to get them, but certainly to the extent that individuals have such devices that they may want to wipe down the handles of the shopping cart or the gas pump and similar devices as well. And with that, we will open it up for questions.
Dr. Hornstein, I'm going to step forward here. As you mentioned, there were 2 cases now under the age of 18. Is any significance in that? Because I know we talked a lot about children and their ability to,
right.
contract this as readily. I mean, what's the significance of having two now individuals? Is there anything that we should be aware of?
I don't think it changes the calculus at all for our population in general. We certainly expect to find household transmission inclusive of children when we have known cases, and that's exactly what the situation is here.
Royal Grundy High School just put out a push to parents saying that there's a sophomore at their school that has tested positive for COVID-19. Is that true?
Well, the good news is that I don't even know, so nor would I tell you if I did. I know that the population, sometimes the infected person themselves makes themselves known to their community, to their class friends, etc. That's not information that you're going to hear from the public health department, but I'm very sincere when I'm saying I am unable to tell you because I actually don't know.
What happens in that case for that family? Is the whole family, how do their lives change?
Yes. So in that, this is one of the reasons for the school closure, is so that there are no cases happening in classrooms as we speak, as schools have been out for some period of time. We additionally have continue to ask that children out of school do not congregate, because that would be another means of spread. When we do have a confirmed case, we are continuing to do contact investigations, and we put on notice any close contacts that we are quarantining them at home.
Doctor, when you say congregating, is it safe, especially this weekend, is it safe for kids to play with their neighbors or friends, things like that? Or would you advise against that?
Yeah, I know this is a very difficult situation, especially for young children to not have social outlets, especially for children that don't have siblings. But we very much are asking that social distancing of 6 feet, even among small groups of friends, be curtailed at this point in the epidemic.
And that goes with your neighbors. I mean, it's just best to
Neighbors, schoolmates, friends, etc. All right, thank you.
All right, well, thank you, everyone, once again for being here today. Let me point out a couple other things. The media release went out today, which outlines the essential services in the county, which counters are open, which facilities are operating, which services are available, and which are not. So that is available at readyslow.org as well. I want to remind you, all of these media releases, all of this information, all of the statistics as they come in are being put up at readyslow.org. There's also a recorded public health information line that is available 24 hours a day, and that number is 805-788-2903, 788-2903. And if you want to get your questions answered live between the hours of 8 and 5, you can call the county's phone assistance center. And that number is 805-543-2444, 543-2444. Briefings will continue every day. We will be back here at 3:30 tomorrow until further notice. Thank you so much for tuning in. Thank you for staying informed. Please continue to protect each other by staying home and getting out when you can to get some fresh air at a good social distance. And we will see you tomorrow. Thanks.